Hey guys, can you hear me?
Yes.
Awesome. Let's get nice and intimate because it's hard to compete with all these honking cars over here. I know a bunch of you, not all of you. My name is Carrie Santoro. I'm the community organizer with a nonprofit called Power Northeast. And I also organize Tuesdays with Toomey from its inception in January through April. I'm really happy to see that it's still going strong. So, yeah, let's hear it. You guys are amazing. This has been going on since January 10th, every single week, just so you guys know that. Now, we know that Senator Toomey and his Republican colleagues have had their eye on Medicaid for a long time. They have been circling this prey for years. Medicaid accounts for a huge portion of our federal budget. It is the kill of a lifetime for the poachers in Congress who want to drain it and line the pockets of the rich and powerful. Senator Toomey, while you rail against this program, Medicaid provides for 2 out of 5 children, 1 out of 2 people with disabilities, and 3 out of 5 seniors in nursing homes. Older Pennsylvanians will be disproportionately affected by cuts to Medicaid. The same older Pennsylvanians who helped to put you in office. Despite the ongoing narrative of racist, classist, and sexist dog whistles from you and your Republican colleagues, the fact remains that 1 in 5 Pennsylvanians gets their coverage through Medicaid, the majority of whom are children and older people. Once again, we ask Senator Toomey, whose side are you on? That's right.
Whose side are you on?
Now, we know healthcare is not a partisan issue, it is a moral issue. In the Hebrew scriptures, God says this through the prophet Isaiah. This is the kind of worship I'm after, to break the chains of injustice, get rid of exploitation in the workplace, free the oppressed, cancel debts. What I'm interested in seeing you do is sharing your food with the hungry, inviting the homeless poor into your homes, putting clothes on the shivering ill-clad, being available to your own families. Reverend Emily McNeil says if we read carefully, this is not just addressed to us as individuals. It is an instruction about how to live in community. The well-being of our society is tied up with the well-being of the most vulnerable.
Yes.
1/3 of all births in Pennsylvania are paid for by Medicaid. 38% of our children can see a doctor when they are sick thanks to Medicaid.
Yes.
Senator, do not call yourself pro-life when you are actively robbing the vulnerable to feed the privileged. Again, healthcare is not a partisan issue. It is a moral issue. Despite your efforts to undermine the ACA by falsely claiming it is failing, while insurance companies rake in record profits. Right. And that Medicaid is a drain on the federal government, even though it is more cost-effective than Medicare and private insurance. An overwhelming majority of Americans believe that access to health care is a moral issue. And, by the way, that the United States should be able to afford universal health care if other nations can do the same.
Yes!
And Senator Toomey, I would like to preemptively ask you not to pervert the meaning of access to care, as you are one to do. Do not tell me that someone earning $20,000 a year has access to a plan that costs $12,000 and that it is their choice not to purchase it.
Whose side are you on, Senator Toomey?
Whose side are you on?
In 1964, Dr. Martin Luther King said, "There is nothing new about poverty. What is new, however, is that we have the resources to get rid of it." Reverend McNeil reminds us the same can be said about illness. There is nothing new about people getting sick, but we now have the capacity to cure more disease, to alleviate suffering, and improve the quality of people's lives. to have that capacity and yet deny that care from those who cannot pay is wrong. Again, Senator Toomey, healthcare is not a partisan issue, it is a moral issue.
Healthcare is a moral issue. Healthcare is a moral issue.
But we know that Senator Toomey does not speak the language of morality. So let's break it down nice and simple for him. Senator, you and 12 of your white male colleagues, have been tasked with developing a replacement plan to replace the heinous Republican replacement plan that passed in the House. This bill was so toxic, the Senate did not even consider bringing it to the floor for a vote. According to the CBO, it would have cost 23 million Americans their insurance, while raising premiums 20% and cutting Medicaid by $800 billion, which would effectively kill this program, again, that insures mostly older people and children. And to what end? To finance an enormous tax cut to the wealthiest families, insurance companies, and pharmaceutical companies. Let's get real, many of whom have you in their pocket.
That's true.
We, as the people you swore to represent, demand that you do better. On behalf of your constituents, you must oppose any bill that A, ends the Medicaid expansion, which helped to insure over 700,000 people in Pennsylvania alone. B, ends the Medicaid program as we know it through block grants and per capita caps, which would decimate our state budget. Or C, insures less people, and yes, Senator, that includes putting premiums out of the reach of everyday Americans. Keep in mind, Senator, that while you are not up for re-election this next year, many of your Republican colleagues in Pennsylvania will be.
That's right.
When you look at pictures of the bodies of your constituents today, will you circle them as prey, beholden to your donors in the insurance industry? Because make no mistake, how you exist in this moment will have a long-lasting effect on your party. Now is the time to access your humanity. Put people before profits and Pennsylvanians before party. Thank you guys so much for being here.